What to know before getting stem cells. My name is Dr. John Hughes. Do we have a laser pointer in here? We should have brought the cat toy. I have a little practice called Aspen Integrated Medicine. I've been in the Valley since 2009. I came here upon invitation of a guy named Dave Jepson. He's a pretty well-known chiropractor. Some people love him, some people don't like him, but he's been in the Valley for years, and he invited me to work alongside him several years ago. Now I've been in the salt, been doing mostly injection treatments. That's kind of how I got into doing stem cell work. Large part of my work also is having patients with brain injuries that we treat with stem cells as well. What's pretty unique about, and I'll just say this as a sort of up front, what's unique about these treatments is that not only do you get sort of a treatment for your knee or your back with some of the cells you've been using, but it can create somewhat of a paradigm shift and a transformation, not only at a physical level, but at a subconscious or maybe even a spiritual level. So that's kind of what excites me about the whole thing, and I'll just talk to you more about it. Don't hesitate to ask. My girlfriend, Megan Haynes, she prepared this very nice lecture. If you ever need help with a PowerPoint, just ask her. We're going to talk about embryonic versus adult stem cells. Anybody remember the 80s, 90s controversy about embryonic stem cells? Well, we'll just go through a little bit of that. I don't use any embryonic stem cells. I don't know anybody that does, unless they're in a research institution now, just because of the controversial nature. So when I say stem cells, as it is now, we're using almost entirely just adult stem cells. There is multipotent versus pluripotent stem cells, and those are just another way of looking at the cells, mesenchymal versus peripheral blood-based stem cells. We're just going to help you understand what's out there, what people are doing, what we're doing, and maybe how to get the best benefit from the stem cells that are available to the public now. Keep wanting to click this like twice tonight, or 3 times. What are stem cells? Anybody know off the top of their head what stem cells are? When we say undifferentiated, that basically means the cells have not turned into new tissue. So in your body, we have multiple cells. We have blood cells, we have bone cells, we have all kinds of different cells that make up tissues. Tissues might be bone, muscle skeleton, whatever you think of organ, variety of different things make up tissues. Stem cells are cells that are just kind of like blanks. They can turn into any kind of new tissue, or they can turn into certain types of specific tissues. So we're going to talk about the different types of those. Their design is stimulate regrowth and bring blood flow and bring other stem cells to the area. And they can be obtained from bone marrow, adipose tissue, blood, embryonic tissue. All the cells that we're going to be talking about are already in the body. They're already working every day to help you repair. Every time you get up, every time you breathe, every time you move, your stem cells are working. They're repairing that tissue. They're regenerating the tissue so you have a lot more of it to use. The thing moves a little bit. So embryonic stem cells, they're derived from the fetus. We're not going to talk much about these because these are pretty much not readily available. The whole idea that we're throwing away babies and taking their dead tissue. So that's ethically controversial, and they're only used for research purposes in a very limited number of places. So stem cells, as we talked about, are derived from bone, adipose is fat tissue, or blood. They require some expertise by the physician, quality control. They're readily available, less expensive, mostly used for regenerative and cosmetic purposes. People that get breast or buttocks lifts or things like that sometimes use stem cells. Sometimes they use it for joint enhancement or autoimmune conditions. That's what we're going to talk about today. They are allowed in the US under certain conditions. So this is just a brief overview of what's multipotent and totipotent. And those are big words, but they don't really have to mean anything really big. Pluripotent just means that they can turn into just about any cell, any type of tissue. Multipotent means that the target is determined to a certain type of tissue. So the best way to think about this is pluripotent cells are more like babies. Multipotent that haven't figured out what they want to do with their life. So there's a lot of babies still out there. And then there's multipotent, which are more like teenagers or college kid cells that already have sort of a career path chosen or a major they've chosen to focus their life on. This is just showing you here kind of what happens in what's called the germ layer. The germ layer is the different layers of the embryo. Embryo is the baby, the fetus turns into an embryo, or embryo turns into a fetus. And what you get is different stem cells that turn into different parts of the body. We won't go into detail too much about that, but just remember, multipotent is more like a teenager or a college kid, pluripotent like a baby. Multipotent stem cells, bone marrow, fat, adipose, and muscle. They only form cells types from the mesoderm. We're not going to really talk so much about that, but that's basically an area of the embryo that turns into middle tissues of the body. That's what I think of mesoderm, like blood, like organs, like connective tissue. So they have a developmental trajectory towards a specific type of cell. Just like I said, they're more like teenagers, and they're already a little bit differentiated, which means they're already a little bit oriented towards a certain trajectory of development. Pluripotent, we usually get these from the embryo, and that's the embryonic stem cells, or the blood. And we'll talk about these pluripotent cells from the blood a lot. They're young baby cells, as I said before. They're still kind of figuring out their life. They don't have a trajectory of what tissues they're going to turn into. So mesenchymal versus peripheral blood stem cells. So mesenchymal, as I said, are multipotent cells. Multipotent come from the mesoderm. And if you look at what I talked about here, these are like middle tissues. They're fat tissues. They're adipocytes, which is what we think about. They're chondrocytes, which is cartilage tissue, and they're osteoblasts, so they're bone tissue. Think about not the skin, not your nervous system, which is kind of different layers of the embryo. They're actually sort of in the middle of the body. Whereas pluripotent, which is blood-based stem cells, these can turn into any kind of cells that are from the embryo. So it could be the nervous system, it could be other types of tissues that are available. They can also turn into, fat and bone marrow as well, but they're mostly going to turn into what tissues that we orient them to. So, does that make sense? Everybody getting this? Pluripotents like a baby. Multipotents. So mesenchymal are multipotent cells. They modulate endogenous tissue. They're already on a developmental trajectory. So mesenchymal and multipotent are pretty much used interchangeably here. They're specialized only to certain cell lines. And the great thing about these cells, they provide lots of growth factors, over 480 of them. They reduce inflammation. They can improve your immune function, or at least modulate it, especially for people with lupus or MS or conditions like that. And they may actually support joints and doing that. So most, if you ever hear stem cells out on the market, you might think of bone marrow-derived stem cells or fat-derived stem cells. That's what you want to think about with mesenchymal or multipotent cells. Clinical indications and side effects. The most common, as I said before, is taking fat to fat or bone marrow to bone marrow. That's what's done. Stem cells have been done in the United States in this way ever since the 80s, 1980s, and we started taking bone marrow from one patient and putting it into another patient and saving them from leukemia. So we actually had bone marrow transplants. Very expensive procedure to do one patient to another. It's less expensive if you decide to take one person's bone marrow and then put it back into the same person after the stem cells have been activated. So that's kind of what we use these cells traditionally for. Alternatively, ever since probably about 12 years ago, it became very popular to take some of the stem cells in fat and bone marrow and inject them into joints, inject them into areas that have inflammation of the body, and see if we can calm down that inflammation, see if we can help. There's people that have done great work with this. Very most importantly with autoimmune diseases, these can be injected in the intravenous system. The only problem with this is these cells, like I said, have tons of growth factors. They don't really turn into new cartilage if you inject them into the joint. And if you get back to our understanding of these multipotent mesenchymal stem cells, is that they're not turning into new cartilage because they're actually just supporting the cartilage that's there. They go in there, and instead of turning into new cartilage, they're not targeted to turn into new cartilage. They're targeted to turn into bone marrow, or they're targeted to turn into fat. So when they get into a joint where there's damage to the cartilage, they just release themselves. They release their growth factors into that joint, and they actually give some therapeutic benefits, but they're not turning into new cells. And that's something that's really important. Studies have shown that only 1% of these cells are even still alive after a week following like a joint injection. So that's where you have to be careful with these people who are saying, okay, these stem cells are going to cure your joint disease, or they're going to make your neck or your back or hip or whatever pain go away. What we have seen is that the pain does go away for some patients for 6 months to about 2 years. And then patients have to either do this procedure again, or they just live with sort of the degenerative aspect of their condition. So the dangers, specifically, is that it's not an easy procedure. I've seen this. I've been trained in doing these types of cells. The hardest thing you have to go in, unless you have a lot of adipose tissue and you really want some liposuction, it's not the most fun thing to do. And I don't know if anybody's ever watched it, but Google YouTube, or get on YouTube and Google liposuction before you do these procedures, and you'll decide if you want to do it or not. The other thing is, if you harvest bone marrow, they take a pretty big aluminum steel needle, they jam it into the back of into your hip, basically, your pelvis, and then they pull out all blood tissue. So bone marrow, blood derived, bloody bone marrow tissue. So it's not the most pleasant procedure. I wouldn't recommend doing this every couple of months. If you're going to do it, probably want to do it every so often, maybe every couple of years. There are companies that store fat, so if you only want 1 or 2 liposuctions in your life, you can go back and get your fat from another place later on. So in Mexico, they'll store up your fat and hold it for you. The great thing is they modulate the immune system, they calm it down, kind of like prednisone in some way. They give this systemic calming. You already know what prednisone does, calms the immune system. You get poison ivy, your immune system flares up, you put prednisone, you take a pill, or cortisone cream, you ever use that. So it's a good thing. However, you can get predisposed to infections if you get too much of that immune modulation. Calming down the immune system is not the best thing for the body always. And like I said, they reduce inflammation for 6 months to 2 years, but they don't really create new stem cells where you inject them unless it's in fat or the bone marrow from where they came from. And now, in the next 36 months, the FDA has decided that they're not really going to allow people to use these cells for non-homologous use, which basically means if you don't put the bone marrow back in the bone marrow, it's not going to be allowed to be used in the United States. Or you don't put fat back in the fat, they're not going to let you do that. So that's going to restrict a lot of clinics around the country, and it's part of the reason I'm giving this talk, is because I think some of these clinics will be doing a lot of other things that may or may not give as much benefit. So lineage uncommitted just means that these cells are, like I said, they're still blanks with light babies. They haven't figured out what they want to do. Now, how does the body know? So you think they're blanks, okay? So how do they turn into anything? So the great thing about stem cells is they have these signaling molecules. When the body gets hurt or inflamed or injured or overused, you breathe really hard after exercising, it sends out signals to actually bring stem cells in there. So you throw in stem cells into your body, especially these types of stem cells, and they migrate to the areas which are most injured. So let's say you have head injury, but you also have knee pain. How does the body know? Usually it's the more acute type injuries that the stem cells are going to go towards. So that's why if you want to treat the knee, you should actually inject the knee or inject closer to that area, because it's going to focus on the area that's closest to it as well as the most acute. So don't just throw in stem cells into the blood, which we do as well. But these are baby stem cells that get their direction from the cell, the tissues that are around them. Tissues around them are called their parents, their guide. So, all right, so lineage uncommitted, we're talking about that. And the unique thing about this slide is really exciting because it shows parts of the embryo, the endoderm, the mesoderm, and the ectoderm. Like I said, we talked about the mesodermal tissues. These are mesenchymal stem cells. They can turn into mesodermal type tissues from which they came. So if they came from cardiac muscle, they can turn back into cardiac muscle. If they came from skeletal muscle, they can turn back in. Red blood cells turn back into red blood cells, or smooth muscle tissue. So things like that. But ectoderm, for example, we'll go over here to the right. That's skin. Those are skin cells, or neuron cells. Those are gum cells around your teeth. So if you throw in fat and bone marrow tissues, they're mesenchymal stem cells. They're not going to turn into new skin. They're not going to regenerate that, even if they didn't come from that area, and they aren't oriented from the embryonic layer to form that. So the pluripotent peripheral blood stem cells can turn. And that's what this whole slide is all about. This whole lecture is about these blood cells that we all have in our body, easily access through our vein, and turn into new cells of the embryo, which basically is any kind of cell that is in our body. Lung, thyroid, new organs. So that's kind of exciting. So clinical indications, like I said, these are regenerative cells, so they actually do develop into new target tissues. They do turn into new joint cartilage potentially, and we've used them for treating, like I said at the beginning, traumatic brain injury, chronic pain, ligament, tendon injuries, ACL injuries, for example, diabetes, osteoarthritis, osteoporosis, Alzheimer's disease, fertility, aging. The list goes on and on, and it almost is like, I don't want to say it's a cure-all type thing, but it's already in all of our bodies. These cells are doing all these things already. They're doing the magic. Now, if they're already doing this, why do we need to take them back in? Why do we need to take them out and concentrate them and put them back in? Because it's not just having the cells in the body, it's activating the cells and placing them where they're needed most. And that's what the practitioners do that actually can help patients most, is they actually harvest the cells from the blood, they concentrate them in with what's called plasma, and then they re-inject them. So if you had these cells, they're trying to repair your knee, for example, they're constantly doing it. That's part of the reason you have pain in your knee, because that's a cell signaling molecule. It's something called bradykinin P, or substance P. But there's not enough cells to actually repair it. So what we do as practitioners is concentrate those cells, and then we re-inject them, and we activate them in specific ways so that they're woken up, they're alive, they have energy, they want to go do something. So this is just a very simple case study, and I'm not going to explain too much about this, except that you can see a fracture in the vertebral spine. This is an X-ray, actually looks like an MRI of a patient's neck, and what you see is a fracture that didn't heal for 9 months. This person lived with a fracture in their neck for 9 months. They got treated with peripheral blood-based stem cells, and they were injected right into that area. Like I said, we're going to concentrate those cells and put them in locally, and then the fracture got fully healed. And this is the old picture right here. This is the new picture. So pretty exciting that these cells, and 4 months is about exactly the right time to redo this again. Because what I've seen in my practice clinically with these cells is it takes about 4 months for the patients to see the maximum sort of therapeutic benefits of these cells. And actually, it may not be the maximum, but to see the main therapeutic benefits of the cells. So just to compare and contrast, a mesenchymal multipotent, mostly coming in the modern day world from bone marrow and fat. Bone marrow transplant, breast, lips, cheeks, buttocks enhancement, or systemic inflammation like autoimmune conditions, renal failure, graft versus host disease, pulmonary fibrosis, diabetes. So everything where the body's trying to attack itself, these cells can say, hey, let's take a break, let's calm down that, and modulate that. So in most of that typically is growth factors that help the system. It's still a mystery to me entirely how they do all this. But if you're putting these cells back into fat or back into bone marrow, they have a great purpose. They work amazing. They can turn into new tissue. If you're just putting in an IV, for example, intravenously, they're really great for helping with things that are systemic inflammation or autoimmune conditions. They've actually done really great studies with people with heart attack. They've injected them right into the heart and restored the heart muscle. So that's where I've seen some of the most important uses of these cells out there, and I hope they are allowed to continue using these cells for that purpose. Blood-based and pluripotent, I really feel like this is the cell of the future, and cell of the present. There's not a lot of practitioners yet using these cells. Primarily, I think just because of the availability and knowledge. At one time, these cells were not even seen under a microscope. They're very, very tiny. They're babies. They're not grown-ups. They don't look like grown-ups. They don't look like teenagers. They're tiny little babies. But when they have the chance to mature, they can really do some amazing things with conditions like Alzheimer's disease, diabetes. There's fertility clinics that use these for traumatic brain injury, anti-aging. I have a friend in Golden that is got a clinic. He's got a waiting list of people to come see him just for these types of cells. And he has an anti-aging clinic. That's all he's using it for, is helping people stay mentally awake and strong into their 70s and 80s, even later. So that's what's so exciting about these cells is I don't want to call them a fountain of youth or a panacea, but it's pretty much God's gift to us to be able to use them and help other people with these cells. As a doctor, I mean, the privilege of that is kind of amazing. I've never seen a better therapy for joints than this type of treatment. So making a stem cell decision, bone marrow, and you can see it, sort of the exciting aspects of these bone marrow, how they're kind of going in deep with some big needles, and not to scare you away because it could be enjoyable for some people. The recovery time is somewhat significant. Most patients feel pretty sore. The cost is not. If you have insurance and you have to do this for leukemia or something, absolutely, it's worth any penny to some degree. But they're not cheap cells to harvest. They're not unfriendly as far as painful. The adipose, the cost is, it's definitely liposuction. Like I said, if you have some extra belly fat, these might be worth a try. I think the cost for liposuction in general is about $5,000 or $6,000, and then they just refine these cells for another few $1,000s. So neither of these are cheap or pain-free. And like I said, before you do any of these procedures, just watch a video on YouTube. Peripheral blood-based, there's clinics that charge as little as $4,000 or $5,000, and most of the cells are actually around the world. It's about $8,000 to $10,000 to do these. So these are very easily done, and like I said, I think they are the cell of the future, and one of really the easiest ways to help patients stay alive and fit for a long time. So like, I'm biased, of course, because I use these very small embryonic blood-based stem cells. I'd like to see more people using them just because of benefits and what I've seen is miraculous findings with brain injuries, joints. It's really been great. So if you have any questions about those cells, I'm pretty well versed. Mesenchymal, there's lots of other factors to know. So have you guys explored, I figured you wouldn't be here if you hadn't explored any stem cell technologies at all. Have you guys ever looked at any of these cells at all? Yeah. Oh yeah. Yeah, and it's different for everybody. I wrote six months to 2 years. I've got patients who've used bone marrow aspirate into the knee, and they're like, yeah, 18 months later, feels the same as it did before. So some people get really good benefits. Some people, it's all depending on the degree of injury. If you have a really bad injury or really bad degeneration in your knee, your hip, or neck, or something, then it may last for a year. If you have not so, it may be indefinite. And I think that's the hard thing as a researcher for anything to say, for anybody to say, hey, how long is this going to give you relief from pain? Because it's subjective, and two, it's very dependent on the degree of injury. So, but what we have seen with most patients is it's a maximum of a couple of years, and that's the challenge with it. You don't want to have to do these treatments every couple of years, unless it's something very like that. Anybody else? We know from the literature that they do. I don't know if anybody's actually taken like a picture and said, hey, here's what we had in the nerve, and here's what it came back. But we do. I've seen it. I've seen it with the brain injury patients. I've seen them have more mental clarity and improvement. It means it's about 3 or 4 months after the patients. So when we do them, the cells for brain injury, we actually drip them up through the nose directly into what's called a piriform fossa, which is where the cranial nerve 1 hides. It's the nerves that smell things with in the top part of our nose, and it travels along the nerve fibers into the brain. So we do know that when you even just drop growth factors on the brain of rats, for example, you get regeneration in the nerve. So if all they do is give you growth factors, you can get some regeneration of the nerve. So do they turn into new nerve tissues in the body? I don't know if anybody knows, but when we've seen it outside the lab, we do know that it can. That's a good question. I think that it may be a chronic systemic inflammation. Is it due to autoimmune, or is it just due to an immune response? Because you have sort of a little lingering herpes virus in the body. We all have it lingering in our bodies. It's just how well the immune system is managing. I mean, not all of us, I'd say 79% of the population, based on the literature, has herpes in their system. So it's how much those nerves are affected by the actual immune system's reaction. So I wouldn't necessarily call it autoimmune, I'd call it maybe a hyper response. Any other questions? Make any questions?
I do. So you say your bone marrow transplant doesn't back to back. Because why are those neurotransmitter stem cells good for autoimmune?
Well, I know. It's a mystery, I said that. For one, and it may remain. But there's a lot of different things in the cells. What happens, it's interesting, one of the companies I work with that makes stem cell kits for peripheral blood, they actually are developing a product where they take and encapsulate the fat stem cells and implant them. kind of like ever got like some like hormone implant, like implanted into your body or something, and they were, what's that? It's kind of like insulin or something. Like you remember your shot? It's a shot, but it releases over time. So it stays, it's like a hormone. I don't know if it's plastic, but it'll be encapsulated in something that slowly removes over time. And it releases those growth factors. So that's where I see these cells going, because they have such benefit. And what that's called in the body is keratin. So it's a hormone like fat, which is what a hormone is. It goes, it meets up with other tissues, and then it releases, the types of modulating chemicals that it needs to help. Hormones are very unique molecules themselves. That's why I don't generally mess with people's hormones, especially not women's hormones, because they just go up and down, and not something that you need a bunch of a hormone at one time. You need a little bit at this time, you need a little bit less at another time. And so, you guys aren't any better than hormone engineering, what that is. A lot of women in their late 60s, 70s, 80s use bioidentical hormones, and the hormones modulate, lots of different functions. The hormones, nutritional hormones, for example, have been used for protecting people with women from bone loss, estrogen. And these cells have some of those same kind of qualities. They release different kinds of growth factors that modulate how the body works. And I think that's the benefit of inflammation. They're cell signaling molecules and growth factors that actually calm, and it's kind of like having a governor on an engine in a car. It governs how fast you can push down the gas and make the car go faster or slower.
So what exactly do you keep saying growth factors?
Growth factors are molecules that, like I said, just signal. A very simple growth factor is something like insulin. So insulin in general drives glucose into the cell. So what's that?
Like a neurotransmitter.
Well, not exactly. Insulin the way insulin works is it changes how it's on its permeability. So it attaches to receptors on the cell, and it lets nutritional things get into the cell. And by doing that, it actually stimulates growth of the cell. So people who are insulin resistant, you start eating a lot of fat, you start building up, belly fat, for example, you get insulin resistant, and that keeps you from growing more. The body's trying not to add more tissue. It's like, stop. The insulin's not working. It's not working as growth factors. It's trying to help you not grow more belly fat, or grow more hip fat, or whatever it is. So, growth factors, another popular one is a hormone called testosterone. We all know about Lance Armstrong or Arnold or Sylvester Stallone. Sylvester Stallone uses growth hormone on a regular basis. They wouldn't let him into Australia at one time because he couldn't take his growth hormone. So a lot of athletes or people who want to dope in some way, they'll be pumping themselves full of growth stimulants, including growth hormone. But to do that in an unnatural way sometimes can lead to some dangerous side effects. That's one reason they don't let athletes do this, because it can cause some very dangerous conditions. However, a lot of people use those to meet. A lot of men use testosterone to maintain muscle mass, maintain their heart function as they get older, with a couple hundred milligrams of testosterone every week. So I don't see it as a problem in women fasting. What we see with these cells, and what we see with the benefits is you don't need necessarily these external growth hormones or growth factors, because they're already in the body. If we can concentrate those in specific ways, we can use the body's own resources to help heal in a more natural, more intelligent way, because the body has to start figuring out. PRP is a famous growth factor. Has over 300. Most of that is to stimulate collagen. Your PRP is platelet rich plasma. This is stem cells from the plasma or from the blood. It's actually just growth factor. And I do that a lot as a practitioner. I inject just the growth factors from the plasma because it's an easy process and cheaper to utilize and have amazing success. For similar things, yeah, the peer piece. Thank you guys for coming out.
Thank you, Doctor.
Yeah, nice to meet you guys. Questions? Thanks for coming. Yes, I have an ozone and prolotherapy are both growth factors as well. And it's all really good growth stimulants. So that's another reason why as well. The prolozone is kind of a mix of prolotherapy and ozone. It doesn't inject ozone or similar type of nutrients. I like that nutritional therapy because it's something the body already needs. One of the reasons also that prolotherapy works is because it creates a mild inflammatory response. It actually causes the body to have an acute inflammation area for a couple of days instead of having chronic. Kind of the idea that the body can feel a scratch, but it can't feel a scar very well. So what happens when you get a scar or a chronic knee or back issue is that the inflammation has gone to a certain point, and then due to a variety of reasons, it just can't progress to actually fully heal the area of injury. So there's this chronic swelling edema in the body at the back, ligament or tendon or muscle that's injured, and you have to create that little bit of acute inflammation for a couple of days. So that's exactly how it works. The great thing about these cells is you don't create it. In PRP, you don't create the inflammation, you're just placing the growth factor in that area. When you do prolotherapy, you actually have to recruit growth factors to migrate from that area of the body to the area. So that's what causes the inflammation. It's the body moving all these tissues. That's why you get an ankle, like swelling in an ankle sprain. Because the body is sending blood flow to tissue. It's its own stem cell response. It just, instead of injecting into the joint, the body doesn't exactly do that as easily, so it just swells it. And out of the blood, tissue starts to leak into that area. It's the same treatment, really, that I'm doing when I take people's blood and spin out. It just takes longer and it's not quite as quick as injecting something. I mean, I just get to be the catalyst for what's already happening in me.
Yeah, you have to go through that information period. After that. So, there's that.
Yeah. That's okay.
Just one, does it matter where you take your blood and where you do the injection hospitals?
He does. It matters. And that's why it matters even